Well, I think we're witnessing a public conversation about family violence, about intimate partner and sexual violence, the likes of which we've never seen before. So this is a really important time to be talking about the research of the Muriel McQueen Fergusson Center for Family Violence Research.
Raison d'être is really action-oriented research. Action-oriented research really means informing our actions, so informing our policies, our programs, our services to ensure that they work for the communities.
I am a board member of the Fergusson Foundation and have been since its beginning in 1985. Professor Jim Asher, who was professor of philosophy at St. Thomas at the time and was on our board, said, well, why don't we get really serious and do research, because we don't have enough knowledge. We said, well, if we're going to do it, we have to do it in partnership with an academic institution. UNB seemed to be the institution that was most interested.
To be able to actually come up with solutions to such a complex social problem as family violence, you needed multiple perspectives. We were looking not only at a research team for how to do the research, but also the research team where you're actually going to get buy-in and take-up of the solutions. And I think that was one of the innovations of this center that was so different than what had been done in the past and what was done at the other centers that was set up at the same time.
The work of the center has just, it's been phenomenal. They are continually reaching out, encouraging partners in the community, not only in Fredericton but across the province to get involved. And I think that that has a trickle-down effect to our frontline staff, whether it's in policing, whether it's in hospitals, whether it's in the school system. Their reach into the community has been far and wide.
From the beginning, we said that the research question should actually come from the community, not from the academy. So this is not somebody reviewing the literature and saying, oh, here's a different question that hasn't been answered we could do research on. And when you have a system like that, when you have a process like that, then you are actually working on evolving questions and the key issues for the people on the front lines, for the people who are personally affected.
When I did my graduate studies at UNB, the focus of my research was on community policing and organizational change. And I am a great advocate for community policing and getting as many partners involved in finding solutions, because the police alone cannot handle this. Nursing alone, doctors, school systems, centers, research efforts. It takes an entire community and a network of people pulling in the same direction to affect change. And I think that the center has been a pivotal point in pulling those community partners together.
So the research that we are doing on the abuse of older adults is set to influence programs, policies, services. Our research itself has been to include these service providers, public agencies, to be able to really understand where they stand on the issue of the abuse of older adults, get to learn from them, as well as other community organizations, on what is available, what can we provide to older adults, and how can we best suit their needs.
Social problems are so complex. If it was simple, we would have gotten rid of family violence a long time ago, you know? So it's not so simple. Solutions are complex, and those are the kind of issues that we really need to all work together on. 25 years later, guess what? It turns out it really was a good idea, and it's taken on a life of its own. There's been buy-in from so many people, and if we counted up how many people at UNB and how many people in the community and how many people in government have been involved in the center at one time or another, this would be a very, very large number.
I'm proud to be part of a very creative and innovative group of researchers, students, faculty, community members, and government that are addressing this problem in this time. And I'm very confident that we're contributing to solving the problem of family violence and making life safer for our families and our communities in Atlantic Canada.
So I think we can celebrate having such a success story in our small province, at our small university, and we can really celebrate that this center has made a difference. It's still going strong. It will continue to make a difference. That's something to celebrate.